So continuous to the previous slide, this is the slides which talks about the hypothalamic pituitary adrenal axis involvement in causing fear. And in earlier slides, we seen like more of the region, the neurochemical regions which is responsible for anxiety. But here it's endocrine output, that is hormonal output is important things. And as you know, like the cortisol increases usually happens in any kind of fear, the steroid release. And here the prolonged of hypothalamic pituitary adrenal axis, that is HPA activation, which leads to the increased level of the cortisol, and the increased level of cortisol in the body have lot of implications on health, especially like increase in the coronary artery disease, type 2 diabetes, and also the stroke. So as you know, like the anxiety disorders not only which is causes more of the behavioral aspects changes, it also causes the pathological diseases as we see here because of the endocrinic effect. And this is what the HPA axis has an impact on the stress. So you can see this is the normal stress response in any adult stressor. There is a corticosteroid releasing factor, which releases in turn the ACTH, that is adrenocorticotropic hormone, and this in turn will leads to the glucocorticoid release. And this, when it is released, is in certain amount quantity, but later on there is an inhibitory actions like which inhibit the CRF release. So this is same like how a typical neurotransmitters where it releases like especially the adrenal noradrenaline, it goes back and acts on alpha 2 receptor to decrease the further release. It's also same thing, it's a positive feedback mechanism where glucocorticoid release will go back and inhibit the CRF release. So here, this is a normal stress response where we have a control over the CRF release with the glucocorticoid released, what it is released, it will control it. So it's everything goes in a very controlled way. That's how why the stress that we exhibit in our daily activities can be controlled here. But if you see here, it's also the same mechanism, but here the CRF release, ACTH release, and steroids release, it's the same till here. But the feedback mechanism that the steroid release here, the excessive in the certain quantity is released here, it has to go back and stop the release of CRF as the way it happened here. But here it's not happening. Why is because the steroids cause a lot of hippocampal atrophy in this region. So because of this, the reason disinhibition of HPA axis by hippocampus. So the excessive CRF release happens here, and because of that, there is higher cortisol level, and this higher cortisol in the level which cause abnormal stress response. It's again, it may cause the anxiety disorder, and the another important thing is it also may cause major depressive disorder. So it has a very complicated actions here. So you can see that the anxiety and depressions, so for both the level of cortisol is very important. And next we'll come to the pathophysiology of the anxiety disorders. We have seen till now more of neurological association, and here there are a lot of pathological anxiety occurs states here. And as we know, like it involves with multiple regions in the brain, and also several neurotransmitter systems are involved here. So as we know, in any kind of neuropsychiatric disorders, these three hormone neurotransmitters are very, very important. That is norepinephrine, serotonin or 5-hydroxytryptamine, and also the gamma aminobutyric acid. So these three, and along with the dopamine, another one. So these are all the few important neurotransmitters that involved in any kind of the neuropsychiatric disorders. So first model is the norepinephrine model, noradrenergic. So here we see like the any fear or worry, we can see that the body get more of excited in sense again there is more release of adrenaline. Okay, so that's what we call it as adrenaline rush. Okay, so anyone who fear, so because more of vasoconstrictions happens, the whole body nervous system get constricted to get more of fear. That's okay. And this is again involved because involved in autonomic nervous system. This anxious patients, it becomes more hypersensitivity for noradrenaline, and also for any stimuli it becomes the neurotransmitter shows lower reactions. That's how we can see people who are in a very anxious state, they are become very alert, very conscious. So even if a small thing happens during that the panic, the anxiety state, they overreact. So these are all because of the over reactivity of the neurotransmitters. And also, as we know, like the locus cellulus, that is we known as the LC, which usually controls the fear, okay, and the anxiety. So it activates norepinephrine release, and because of this, the sympathetic system get more stimulated, and also the parasympathetic nervous system also. The other model is 5-HT model. This is the quite common, as I told, in neuropsychiatric disorders. It's involved. So here the symptoms GAD. Here the GAD is nothing but generalized anxiety disorder. Okay, so we have different classes of disorders. Now we'll talk about that. Is one is generalized anxiety disorders, panic disorders, panic attack, and SAD. SAD is nothing but social anxiety disorder, and also PTSD, that is post-traumatic stress disorder. So these five disorders will very mainly focus in the anxiety disorders. One among that is the GAD, which usually reflect excessive. In this disorder, the 5-HT transmission is again the overactivity is seen in the stimulation of 5-HT pathway. And the another one is patients with the SAD, that is social anxiety disorder. Sorry, it should have been more been abbreviated here. Okay, but it's have greater prolactin response to buspirine challenge. So usually while testing these disorders, they do some kind of drug test, like they give the buspirone in social anxiety disorder. If there is a prolactin release is more, then we can classify it as social anxiety disorders. So it is indicates that there is a more central serotogenic response. So as you know, like the prolactin is also an acts on the 5-HT receptors. And also the 5-HT in panic disorder is much unclear, but it may have a role in development of any anticipatory anxiety. Just before the anxiety, there could be some signs and symptoms, anticipations. And also the data suggests that 5-HT and HT2 antagonists like metachlorphenyl, piperazine is also cause increased anxiety in PTSD, that is post-traumatic stress disorders. So if you see here, more than the noradrenergic, the 5-HT models is almost seen in all kinds of anxiety disorders. So it has a greater role in this disorder. The another very important model in this is the GABA. So as you know that it's one of the inhibitory neurotransmitters in the CNS, which controls all the emotionals of a person. So many drugs now which is used as an anti-anxieties target this GABA receptors. That's the very important thing. So treatment aspect way more than 5-HT they target more of GABA. So as you know, like benzodiazepines, they are one of the uh, widely used drugs which enhance the inhibitory effects of GABA, which has strong regulatory and inhibitory effect on 5-HT and norepinephrine dopamine system also. And also the why the anxiety main symptoms, you can also see that it can be correlated with the GABA system, which says that the GABA system is underactive means the activity is reduced or down regulated. Okay, so because of this the anxiety symptoms increases. It takes predominant place over the inhibitory systems. And in the generalized anxiety disorders, the benzodiazepine bind in the left temporal lobe. It's also reduced the abnormal sensitivity to antagonism of benzodiazepine binding site. And also decreased binding was demonstrated, is well documented in panic disorder also. So any abnormalities of GABA inhibition, they increase the response to stress in PTSD patients. So you can see that the GABA model is widely accepted, and the drug available for treatment of anti-anxiety also uh, on they usually act on these GABA receptors. And this is overall neurotransmitter circuits and summary like. So any kind of fears, the amygdala center circuit is very, very important. And any kind of worry, CSTC, with the cortico-statio-thalamic cortical loop, that is CSTC. So both is involved. So in fear loop, you can see that 5-HT, GABA, glutamate, and cortico-releasing factor, and also hypothalamic pituitary adrenal axis, norepinephrine, voltage-gated ion channels are very much involved in this fear loop. And is in the worry loop, again 5-HT, commonly GABA, glutamate, and dopamine is again involved in this worry loop, norepinephrine. So in the worry loop, there is no the CRF and the HPA involved. The other things are all common, but dopamine is involved here. Are you all following?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
Any doubts?
Yes, sir. Yes.
No, sir.
Yes. Sir.
No, sir.
No, sir.
Okay. So we'll come to the symptoms. The symptoms, as I told, it's classified on type of the anxiety disorder. So the different anxiety disorder, as I told here, we see is the general anxiety disorder, panic disorder, panic attack, social anxiety disorder, and PTSD, that is post-traumatic stress disorder. These are the 5 common main anxiety disorders we are seeing here, the symptoms. The first we see the generalized anxiety disorder, that is GAD. So we are seeing a lot of the symptoms which way they fear and the worry loop, a lot of the panic, phobias, and different anxious moments, and all those things. So this criteria, I can say that requires very persistent symptoms. Means it's not for 1 day, 2 day. It's commonly as a human being, we also will have such kind of thing. But you can see that here the for the most of the days, if it is sustains for at least 6 months, only then we will classify as GAD. And also the features of this is more of unrealistic and also very excessive anxiety and worry about number of events, activities, and other importance. So that's the most important. More of this is maybe work related or social related or family related or any kind of this for a very long time. If it is happens, then we can consider this as the generalized anxiety disorder. So this is an pictogram which shows about the extent of how much the generalized anxiety disorders or other disease involved here. You can see this how much generalized anxiety or fear. You can see the center part here. Uh, the this is the part of the fear, and this is the generalized worry, the how much extent. And if you see here, the fear, the anxiety is more than the worry. You can see then the generalized anxiety disorder. So here there is a concentration, as you know, in anxiety disorder, there will be more increased concentration, fatigue nature will be there, the arousal because of the worry, the arousal also is there, and also the muscle tension, irritability, which is a part of fear, this, and also sleep. Even the sleep and the arousal, if you say this, they have equally here. Person may get sleep, then again the arousal. So there is a lot of, you can say the disturbance in sleep also. So this is the overall thing which talks about the symptoms in specifically in the generalized anxiety disorder. And we have different classification of symptoms here, like psychological, cognitive symptoms, and physical symptoms. So you can see that psychological and cognitive is more predominantly is more here. So excessive anxiety and worries that are difficult to control, feeling keyed up or an edge, poor concentrations, or mind going blank. These are all the few common things which we usually seen here as a part of psychological or cognitive. And the other one, physical symptoms, restlessness, fatigue, muscle tension, sleep disturbances, and also the irritability. Okay, so as we seen in the next one is the panic disorder. The panic disorder, we have two things here: the panic attack and the panic disorder. The panic attack is, say, like you can see here, it's usually lasts not more than 20 to 30 minutes. So it's a acute form, and in that acute form, the duration is 20 to 30 minutes itself. But how we define panic disorder is it's a series of panic attacks. Okay, that is unexpected panic attacks. So if they're repeatedly coming, that is spontaneously, see that unexpectedly, spontaneously, repeated panic attacks, which involves intense, terrifying fear, similar that caused by life-threatening danger. Suddenly, the people may get feared, anxious. You can see in a lot of in real life also, and even in a lot of films which you say, like if some incidents is happened, bad incidents or any other thing which a person can recall that incidents very frequently and go to that stage of anxious. And this during an attack, patients often describe overwhelming sense of doom, fear of dying, and losing control. So it's more of the chronic setup here, the panic disorder. That's the thing. And the panic attack, as I told, like is just 20 to 30 minutes, and intensity with peak intensity is first 10 minutes is more here. And secondary to the panic attacks, many patients they develop agoraphobia. So the panic attacks itself leads to the agoraphobia. So for fear of seeing some thing. So in the panic disorder, you can see that more of the anxiety, fear, the worry about panic attacks. Okay, so that's a more seen here. And here we can see that unexpected panic attacks comes very unexpectedly. You cannot even predict whether this attack comes or not. And this is what the difference between this and PTSD also. PTSD is expected panic attacks. Here, panic disorder is unexpected panic attacks. And also phobic avoidance and behavioral changes can occur in such kind of. And the symptoms of a panic attack, again, psychological and physical symptoms are classified, like psychologically deep personalizations, derealizations, and fear of losing control, going off crazy, fear of going crazy, and also fear of dying. I think these are all self-explanatory. And physical symptoms also: abdominal distress, chest pain, chills, dizziness or lightheadedness, feeling of choking, hot flushes, palpitations, nausea, shortness of breath, sweating, tachycardia, trembling or shaking. And the fourth type of the anxiety disorder is social anxiety disorder. This is, you can see in the pictogram itself, more associated with the society, social thing, where human being as a social, he lives in a society, lives with a lot of people, he has to mingle with the people always. But if the person is many times come out of this group of people and stay alone, okay, so he is isolated from the social things, activities. So such kind of the signs and symptoms are seen, then we call it as social anxiety disorder. That is sad. So it's an intense, irrational, persistent fear of being negatively evaluated or scrutinized in at least one social. So that is the thing. So if this is a quite commonly we observe in many people, they just avoid the social gathering. They feel like more negative in their mind. They feel they does not like to mingle with them, or they feel like the others may not consider them equal to them like that. So that's why they try to be away from the group of people. And also the exposure to the feared circumstances is usually provokes an immediate situation or related panic attack. And people who have some panic attacks also, they try to avoid, because they know like if I go there, I can get a panic attack in that situation. So those people will try to go away from those people. So the adults with they usually the fear is excessive and unreasonable. They are unable to overcome it without treatment. So for this kind of people, the treatment is very important. Where the to come out of this the social anxiety disorder. If you see the spectrograms here, the social performance and anxiety fear, and the worry about exposure. So here you can see that expected panic attacks. So in the panic disorders, you can say unexpected panic attacks, but here expected panic attacks, phobic avoidance behavioral changes can occur. And in this groups also seen more in under 18 years of age, and duration of symptom is at least 6 months can occur. The fear or avoidance is mainly not caused by a drug or any substance like cocaine, but a general medical or psychiatric disorder. It's more of the person's behavior. So this is the social anxiety disorder now as worry, because it mainly affects is the age that less than the 18 years, and also it's during the mid-teens. Okay, so that's the main uh, worrisome of the SAD. And also, if you see the gender, the rates of occurrence of this disease based on the gender is slightly higher among women than men. And importantly, it's seen in younger cohorts. So it's a very chronic disorder with the duration of 20 years. You can see that the 20 years of this one is very importantly seen. Okay, so the post-traumatic stress disorder, the other one, it's a PTSD, and this is a condition mainly by exposure to any traumatic life events. Some event has occurred, some deaths or some unusual events, unexpected events, and keeping that in the mind, and it comes in a repetitive. So after the trauma is some kind of any injury, even after or injury by an event or any incident. So even that stress is coming out. So here the person reacts to experience with fear, helplessness, and also to avoid reminded of it. mainly thing. So it can occur in any age. That's variable. And one third of patients with PTSD have poor prognosis. So among all the anxiety disorders, this PTSD has very poor prognosis. You can see that 80% have a concurrent depression and anxiety disorder also, the both. And you can see this here is the anxiety, and very importantly in this PTSD is re-experiencing. This is the word we use here, the re-experiencing. The same event is recalled more, and worry also is here. You can see arousal, avoidance, and sleep disturbances. And if you see the PTSD, the hippocampus and re-experiencing commonly having an what is that? So anxiety can be triggered not only by an external stimuli but also by an individual memories. So this is what an incident already occurred. So the same incident is again recalled and talked about. And it's here, as you know, like hippocampus can again activate the amygdala, which is an important, and which in turn can activate other brain regions and generate fear response. So the hippocampus, which is responsible for to store the memory, that again will go on stimulate the amygdala. So because of this, the this is a re-experiencing. Saying you just remember about that bad event or situation, then again the same symptoms can happen. So it's a traumatic, it's a particular feature of post-traumatic stress disorder. This is a re-experiencing symptoms and avoidance symptoms, and re-experiencing more of recurrent intrusive distress. You can see recurrent disturbing, feeling traumatic, physiological reactions, mainly remaining of trauma. And avoidance symptoms like conversations about the trauma avoidance, doesn't want to remember that, or avoidance of thoughts of that, and avoidance of people or places to arouse recollection of the trauma, and also inability to recall important aspect of this one. And amnesia, where there is restrictions of the thought, the shifted effect, and sense of foreshortened futures. Okay. So anything which is career or marriage, if it is there, that this will get more. Try to avoid those kind of remembrance. Also, hyperarousal symptoms. So, hyperarousal systems, there is also in decreased concentrations, easily started, that hypervigilance, insomnia, irritability, or angry outbursts are seen. And there are again acute and the chronic and also delayed onset depending upon the duration. If it's less than 3 months, it is acute. Last more than 3 months, then it's a chronic. Then it's at least for 6 months after post-traumatic, then it is delayed onset. There are a lot of drugs also can cause this anxiety symptoms apart from the other thing. Important drugs like anticonvulsants, carbamazepine, antidepressants like selective serotonin inhibitors, cyclic antidepressants. Even though these drugs are used in treatment of anxiety, but they themselves can cause anxiety. Antihypertensives like phenolphine, antibiotics like phenols, isoniazid, bronchodilators like albuterol, theophylline, corticosteroids, prednisolone, dopa agonists like levodopa. Also, some kind of herbals, which preparations also can cause this, and NSAIDs, drugs and stimulants, sympathomimetics, thyroid hormones, and any toxicity of kind of like anticholinergic, antihistamines, and digoxin toxicity is anxiety is more seen. The another important we can see in the withdrawal also, the alcohol withdrawal and sedatives, they cause more of drug dependence suddenly, withholding the drugs or withdrawing the drugs can cause this, the anxiety symptom. So it's a very clear, like a lot of drugs are involved here. So before evaluating any patients with the anxiety symptoms, we have to see these drugs also, because these type of drugs used for the long term. So we have to evaluate whether this drugs also is causing or contributing to the anxiety symptoms. And apart from the drug, the diseases also will associate with the anxiety. So we can see the diseases like cardiovascular disease, lot of cardiovascular disease, and this is a list, and endocrine and metabolic disorders, and the neurologic, respiratory systems, and many others like the anemia, SLE, or dysfunction. These are all the few things which you can very common see in that. Okay, these are all the list of medical diseases, as I told. So coming to the management, very importantly, the management is quite a little bit complicated here. Then again, as I told, like pharmacological, non-pharmacological, both has to be associated for the better outcome of this disease. The investigations are very quite more investigations are there. You can see like blood sugar, if it in type 2 diabetes mellitus, lipid profile, cortisol level has to be done. As I told, like cortisol is corticosteroid, one of the, because of HP axis involvement, this releases is more commonly seen. And also the urine drug screen, any kind of stimulant abuse drugs which can be observed or that. And also TFTS, that is recommended if the patient has suspected thyroid disease, like weight loss, goiter is there. That is thyroid function test. And 24 urine test for, you can see that vanillyl mandelic acid, okay, and metanerphin. We usually give rule out any pheochromocytoma. What is pheochromocytoma? Anyone know pheochromocytoma? Hmm? So it's more of the alpha adrenergic receptor activations.